There's a hashtag going around at the moment, and I quite like hashtags because they're a great way of taking the pulse of public opinion. The one that is currently doing the rounds is in relation to the COVID measures, and it is as follows. Why are they doing this? That's what's being asked online. Why are they doing this? Good question. We bring you the awful news today of the collapse of another high street retail group, one that owns Peacocks, Edinburgh Woolen Mills, lovely chunky knitwear, and the luxury brand Jaeger. Gone, folded, at a cost of 24,000 jobs. But this isn't jobs. This is people we're talking about, human beings. 24,000 job losses means 24,000 damaged lives. A price worth paying? Collateral damage to tackle COVID? Well, Nicola thinks so. Boris thinks so. Do you? Why are they doing this? The willful obliteration of our economy is not a consequence of anything. It's not an accident. It's policy. The 10 o'clock curfew, right? That 10 o'clock curfew, right, which I'm still waiting for the scientific evidence on, Prime Minister. Well, that's basically just a death warrant for restaurants and bars, isn't it? Quarantine. Oh, let's kill the travel industry, shall we? And face coverings. Now, I hate them, but I wear mine everywhere. And frankly, it's not too much to ask. But can you honestly tell me why supermarket workers and bar staff should have their faces bandaged up for the duration of a 10-hour shift? God knows what the health impact of that will be. Watch this space. Strikes me as cruel. It was emotion, fear, and panic which propelled us into this current COVID strategy in March. People are dying, people are dying. That's what we were told. That was the refrain of the lockdown fanatics, perhaps at the time, understandably so, when we knew so little. We do have an awful COVID death toll. Mid-40,000s. Shocking. Every one a lost life too many. But in a population of 66 million people, and for this, we've borrowed hundreds of billions of pounds and obliterated the economy. Why are they doing this? I'd like another tragic death toll to run in parallel with the COVID casualties. The death toll that comprises those who are dying or will die from other untreated illnesses, suicide, mental health problems, and deaths from poverty. That number, by the way, the number of deaths from poverty, that's exponential. That number is limitless. That's a number that will spike upwards, not just for the next year or two, but for decades, long after COVID is but a distant memory. Systemic, lasting damage. This isn't an accident. This is policy. But this shouldn't be about money. It's about lives, I hear you cry. Turns out, yes, it should be about money. Because money is lives. Because whether it's our brilliant police force keeping us safe on the streets, doctors and nurses caring for us in hospital, teachers and teaching assistants educating our young, the military and counter-terrorism agencies protecting us at home and abroad, not to mention social security, public housing, mental health services, employment, social care. It's all about money. And money comes from the economy. Money is lives. A healthy economy sees a reduction in deprivation and inequality and ill health, and it sees an increase in social mobility, better public services, and a population with better, happier, healthier, and more aspirational and fulfilled lives. That is the British project. That's what we're doing. Well, as a matter of policy, we are going the other way now. We're not just shooting ourselves in the foot. We're cutting both legs off. You realise this is all just a punt, don't you? It's a roll of the dice. It's a gamble. It's a shot in the dark. A scientific experiment in which, for the first time in human history, we're trying to stop a virus. Good luck with that. But it's also an unproven economic experiment in which, on our behalf, hundreds of billions of pounds are being sprayed around on furlough schemes. More announced today. We'll come to that. Vaccine research. That's billions. Empty Nightingale hospitals. Flaky testing. and unused ventilators. £500 million worth. I won't let that go. All of this destruction is policy. Well, there's a growing movement now that want to see the policy change. Not crackpot conspiracy theorists, just thousands of eminent scientists and medics who they've had the temerity to look at the data and to speak out. This pandemic won't stop being damaging and expensive and awful. We will have to continue to borrow the billions, but this time around, to protect the vulnerable and liberate the vast majority of the population, return their freedoms and let them get back to doing what they do best, which is contributing to the powerhouse, the sleeping giant that is the great British economy, and having lives again. The goal of politicians across the Western world is to keep COVID numbers down, because those COVID numbers have become a political project at the expense of everything else, including lost life from everything else. And a word on the borrowed billions. Don't let any politician tell you they're being generous or giving you money. They are borrowing money on your behalf. In fact, it's worse than that. Those hundreds of billions of pounds are not just being borrowed on our behalf, they're being borrowed on behalf of the children in this country that haven't even been born yet. All for a scientifically debatable and economically catastrophic experiment. This is policy. Your kids and grandkids and great-grandkids will be paying for this. We know that now. We can say that. How dare we? How dare we do that to them? The last time we borrowed on this scale, German bombs were raining over London. Hardly comparable, I think you'll agree. Why are they doing this? God knows. Hysterical groupthink, probably. And of course now they're in too deep. But there is a way out of this. Crush the cosy COVID consensus. Listen to other scientists. Protect the vulnerable. Live with the virus. Understand that cases will rise and get back to living. Because this is not what living looks like. This is Talk Radio.